Hello and welcome to our show Health and Wellness Myths and Facts. I'm Sonal Amruta Prabhu. Now, the pandemic has put mental as well as physical health and wellness into sharp focus. Throughout the COVID-19 pandemic, several coronavirus variants have emerged as the virus SARS-CoV-2 continues to mutate and evolve. In November 2021, a variant of SARS-CoV-2 coronavirus emerged and was named Omicron by the World Health Organization. Even if we have a virus that causes less severe disease, this virus can affect the vulnerable and the unvaccinated population. People with chronic diseases should be careful about the management of their conditions during this phase. Diabetes and heart disease both are leading causes of death in India. Relatively younger adults are getting diagnosed with these very serious diseases. Both these chronic illnesses have substantial complications. It is easier then to manage the disease if you are aware of the warning signals and problems associated with these conditions. To talk to us about that, expert advice is going to be key, and joining us today are our experts. Today with us, we've got Dr. Paras Gangwal. He's MBBS MD Medicine Consultant Physician, East Delhi Medical Center in Delhi. Hello and welcome to the program, Doctor. And also with us is Dr. Amruta Prabhu. She is MD CPS Diabetes, PG DIP Endocrinology Consultant, 3D Clinic Freedom from Diabetes in Mumbai. Thank you both, and let's just dive straight into this conversation. Let me take the first question then to Dr. Gangwal. All right, Doctor, it is believed that Omicron infected people experience mild symptoms, or as many like to call it, milder symptoms. However, some patients do experience high fever. Can it cause major damage to the health of people? Should people with diabetes, like they were the most vulnerable lot when it came to the Delta variant, similarly be extra careful when it comes to Omicron?
Yeah, so the current trends in Omicron are like patients who are getting infected are having milder fever. Most of them are having fever for 3 days. Fever rates may go variable 100 to 102 also. They feel a lot of chills at times with headache, body pain syndrome, and then most are, when immunized with 2 shots of vaccines, are settling by day 3 to day 5 and are recovering pretty well without major changes into their lungs, without major hypoxias happening, without any significant respiratory distress that happens to them during the Delta wave. But having said that, there are going to be vulnerable group of lot which are having diabetes, high blood pressure, pre-existing heart disease, chronic kidney disease, or the liver disease, that they have to watch themselves more carefully. A good percentage of them would have problems related to even Omicron variant, and those principles of monitoring your fever trends, monitoring your pulse oximeter SpO2 trends, ensuring that your SpO2 is staying above 95, you are not developing hectic fever, your breathing is comfortable, not developing worsening cough is important. In case you have those SpO2 going below 95 as per MOHF guidelines, developing high fever, or your cough is not settling, you are having heaviness in your chest,
I see.
or you are having transient alteration in sodium, you should report back immediately to your caregiver, and you need to escalate your therapy and management.
All right, just experiencing some audio trouble with you, so we'll try and fix that. Let me take the same question to Dr. Prabhu as well. Dr. Prabhu, you're a specialist in diabetes, so take us through what are your thoughts on understanding and dealing with Omicron, particularly when it comes to diabetes patients.
See, when it comes to the diabetes patients, okay, usually we have to be very much careful because as infections lead to increase in your diabetes. So whenever you catch a milder cold, cough, flu also, that time also your sugars go up. So when it comes with the Omicron, definitely you have to keep your numbers under control. If your blood pressure is under control, your sugars are under control, then you can deal with this issues very much better way. Also, you need to be very careful while dealing with the complications, because if you're fully vaccinated, you don't have much complications with this Omicron variant and all. Even you can see that if you keep the numbers under control, your overall health is better. You don't feel lethargy, because whenever in diabetics they feel lethargy, they start getting weaker. They take a little longer duration to recover from this infections. So if everything is under control, your sugars are under control, you will recover in a better manner, faster manner, and earlier manner. So I think that is most important. Also, I think diabetics should be more careful while, because see, the treatment and other issues, if you have any lung issues, if you have to be create matlab, if you have to take treatment for this variants, then you have to be keep your sugars under control right from the beginning.
All right, so keep your sugar under control if you don't want to get a severe form of this, is what your recommendation is. Let's go to the next question then. In the midst of the surge of Omicron cases, one of the most frequently asked questions is how long an infected patient should stay in quarantine. There are new guidelines coming on it every day. But if this infection is not so severe, then is it okay for the person to get back to his or her routine as and when he or she feels better? Dr. Paras, why don't you take that?
Yeah, sorry for the poor audio connection in the last
This is
thing.
good, sir.
I think it is audible now.
Yeah.
See, there are two things that people need to understand. That one is isolation and one is quarantine. Once you are affected with a COVID illness, then if you are test positive, then you are uh, said to be isolating. And once you are exposed to a COVID person but have not tested positive, then you say that you are in quarantine. So, as per MOHF guidelines currently available, isolation period is 7 days. Once from the day you tested positive, it is 7 days, or you are free of fever for 3 consecutive days, should be able to complete your isolation period. As per world over accepted guidelines by CDC, they break into 5 plus 5 day principle, that if you have affected with COVID, then 5 days you isolate yourself, and after 5 days, if you are symptom free, you are free of fever, you are not having increasing cough, you are not having profound weakness, you can come out with mask, uh, which should be properly fitting for next 5 days. So you can divide it, your isolation period, into 5 to 7 days indoor and to 5 to 7 days outdoor, because in Delta variant it used to be 14 days because of practicalities and lower duration of sign and symptoms that we are dealing with Omicron, observing with Omicron. It has been reduced to 5 plus 5 days. As per MHF guidelines, to reiterate again, it is 7 days, including 3 days free of fever. While we say quarantine, as per MHF guidelines, it still continues to be 14 days, but it does not differentiate between those who are immunized with vaccines. As per CDC, quarantine period is also 5 days, but if you have your shots of vaccines, you can, and you are not comfortable staying inside because of your practical reason, you are allowed to be out if you are vaccinated with mask on.
I see. Thanks for clarifying that for us. Next question is, in the event of vulnerable patient getting infected with Omicron, which organs of the body will be most severely affected by this new variant? Dr. Amruta Prabhu, if you could answer that. It is said to spare the lungs?
Yes, absolutely right. So if you see for the newer variant, this, so usually we don't get that severe infection of outcome you don't see that severe. It doesn't affect your lungs. It majorly affects your upper respiratory tract, that is your nasal, your larynx, your pharynx. Okay, so majorly the infection is in the upper respiratory tract. It doesn't go to your lower, and it doesn't affect much to your lungs. That's how it is, and that's why you can see the isolation period has also been reduced, and you can see the because of the less severity which you see. So it doesn't affect much major organs of your body. Although it doesn't affect much major organs, but still you need to be careful. You have to do the whatever precautions you have to take, at least the gargling or taking steam inhalations, these basic things which you can do at home during your isolation period. You have to do. You have to take a basic treatment. You do not have to go and buy some expensive drugs, anything. The basic management can get you care. If your symptoms are worsening, then definitely seek a help immediately. Check your SpO2s as usual. Even if it is a milder, do not underestimate anything. And it is really too early to mention that whether it really affects any other organs or no. But patients with comorbidities again have to be careful, because it can affect any organs, or it can cause any secondary infections which might affect your organs. So you have to be careful with those numbers again. And I think
All right.
prevention is always better than cure.
Absolutely, always. And, prevention, talking about it, the best way to do is wear a mask, and not just any mask, but a N95. There is not enough time, so we can actually emphasize that and remind you of that as well. Let's go to the next question then. Considering kids below 15 are not yet eligible for vaccination, the risk of them being infected by the new variant is growing with each passing day. How will Omicron then affect the health of children and teens? Also look at toddlers in this case. Dr. Paras, do you want to take that?
Yeah. So we all have to understand that we have our youngsters which belong to age category below 15 to 17 years. They are unvaccinated lot. Their vaccination has just begun in India, and they constitute almost 26 to 30% of big Indian population of 140 plus crore. So that is that percentage that we have to take care. Almost 1/4 of our population, maybe 1/3 of our population belonging to that category who still are unvaccinated. And with this vulnerability and to Omicron and the speed of its penetration, the ease of its getting into one's body, we have to understand that we are going to have a good affliction of this illness into our children group who are unvaccinated and not immune. Good thing is that their innate immunity is robust. Their immune phenomena is better to tackle all sorts of viral infections. What we are currently observing, as per current available literature from the affected countries, UK and South Africa, that most of the childhood affection with COVID are very self-limited. They are as good as our age-old flu-like illness. Most are settling into 3 to 5 days. 1 in 1 lakh children affected would probably need admission to the hospital for observation. Whenever they are admitted to the hospital, mostly they are being discharged with an average admission of just 3 days. The lung involvement is not so common. It's only cough coryza which is happening into them. But not being complacent, anybody affected with COVID, being adult or children, I think our principle should be how quickly are we settling with the fever? Are we able to maintain our breathing and respiration well? Are we keeping our saturation above defined limits of 96, 97, ensuring that it's not dropping less than that value? Also observing us with full recovery over 10 to 14 days, not being complacent, because we have to take care not just 95% recovering well. With our advancement in science, we have to ensure that we are able to save all 100% of people affected with COVID. That's going to be the beauty of it. That's going to be the progress of science. So we have to be watchful, even for MIS that multi-inflammatory syndromes which happen in kids, which data just evolved for Omicron, but currently no significant AMS reported in that. But that takes a while to develop, so we have to observe whosoever gets affected for long COVID phenomena, for AMS, that may be rare, less common, but advancement of science and medical evolution has to take care that nobody is affected with significant long-term ailments related to COVID even, and surely not in short term, no deaths, no significant hospital admissions. We should try to achieve that.
I see. All right. With that, let's slip into a break. When we come back, we'll continue with this conversation on health and wellness, facts and myths. Stay tuned. Welcome back. You're watching Health and Wellness, Myths and Facts, and we are in conversation with our experts. Let's go to the next question now, which is about diabetes. Now, what is gestational diabetes? What causes it? Does it make women more predisposed to developing diabetes post-delivery? Will gestational diabetes actually reduce their immunity, making them more susceptible to infections? That's a question that's on our mind. Dr. Amruta Prabhu, if you could answer that.
Yes, so gestational diabetes is one of the type of diabetes, if you will see. Now, why does it develop? That is the major thing. So during pregnancy, the placenta releases hormones. Okay, now these hormones usually affect and they stop your insulin effectiveness. So that is why they develop the diabetes. And usually women develop this during the it starts amongst from 20th till 24 week, it goes peak. So usually the women are screened during that time. They women are who get predisposed to this gestational diabetes are who have like who get pregnant in their later stages age. Then there are female who have a family history of diabetes. Okay, some female who have a issue of PCOD, they have insulin resistance issues already, so they also can develop, they are more prone to get this gestational diabetes. When you get gestational diabetes, obviously the female see this diabetes majorly 90% of them have this during pregnancy. Once they deliver the baby, it's not there. But it doesn't mean that they are free from diabetes. They have higher chances of getting this diabetes again within 5 years of their lifespan if they don't take care of their health properly. They don't follow diet and exercise properly. And diet and exercise is the only key which will prevent them from getting it further. If they really want to keep it under control, they have to check themselves postpartum. Every 6 to 12 weeks, they have to do a checking of their sugars initially. And then later, once in 3 years, they can do the checking. If everything, if their HbA1c is well controlled, if their sugars are well controlled, they are following their diet and exercise properly, they can do it every 3 yearly. But obviously they should not be relaxed. They should not think that okay, once I'm out of this diabetes, now I will not get it. It is not, it is a myth. They can get it easily if they don't follow any diet and exercise. Also during pregnancy, I would suggest that they should do some yoga, they should do meditation, they should do and keep exercising if they are not in a much higher risk for that, so that their pregnancy is good, healthy, and they don't get any gestational diabetes.
I see.
Also, they should avoid the sugary foodstuffs, the carb content should be less. These things also they have to manage with it.
I see. Moving on to the next question then. A healthy lifestyle is a key to managing all lifestyle disorders, exactly what Dr. Prabhu was also saying. Can a good diet and regular exercise actually help people with heart diseases as well and perhaps stay away from infections? Dr. Paras?
Yeah. So we all know that health is wealth, and we all have been educated well enough to understand that health comes from exercise and nutrition. So, of wellness, when we talk about, two important components are your nutrition and your exercise, yoga, meditation, keeping yourself stress free. So there's good amount of data to prove that when we are having a good, adequate diet full of all macronutrients, micronutrients, trace elements, herbs, and condiments, our immune status is higher and it prevents various infections, more so respiratory infections vulnerability is reduced. Also, when we exercise, our um, immune system, the immune surveillance is better. Their inflammatory marker and pro-inflammatory marker balance shift more towards saving ourselves from various viral infections. To understand it better with respect to the COVID scenario, there have been good amount of data and studies. It was one large study in US that it was proven that a plant-based diet uh, rich in herbs and green leafy vegetables, people's COVID infections were reduced by 10% and severity of COVID infections was reduced by as much as 40%. Similarly, there is data about exercise being able to reduce even COVID probability in those who are doing 30 to 45 minutes of moderate intensity exercise because that elevates your immune functions to a much greater extent. To take away from this, your protein intake has to be adequate, roughly 1 gram per kg. Those who are vegetarian should ensure that they take adequate amount of pulses, legumes, roughly 20 to 30 grams nuts per day, good amount of curd and milk, which can be skimmed, and they should do it regularly. They should be supplementing them with vitamin D or B12 um, if they are deficient in them and their diet is under nutrition as per the guidelines of their treating physician. There is role of zinc also, various herbs and condiments like what are age-old ginger, garlic, tulsi, and even haldi milk has been found to boost immunity as per the available scientific literature. So all those good principles have to be followed. We must have a healthy, nutritious diet and ensure that we are exercising 30 to 45 minutes per day with a moderate intensity exercise. That helps in building up
Sounds so simple yet so difficult to implement. I guess that's the thing here. But let me move on to the next question. It's said that type 2 diabetes can be life threatening, but if treated carefully, it can be managed or even reversed altogether. Is reversal of diabetes possible with people in the Indian subcontinent perhaps? Which type of diabetes do you think can actually be worked upon and can be reversed? Dr. Prabhu?
Yes, so when you talk about reversal, yes, it can be. It is possible. Majorly, instead of reversal, we can say that it can be better controlled with diet and exercise. As just now, Dr. Paras said all about the diet part, so I will not focus more on that. But even the exercise is important along with your diet, and you have to, because lifestyle is a diabetes is a lifestyle disease. So when you modify your lifestyle, definitely you can get rid of it. You can keep it under control. In exercise, you should also focus on your mental exercises also. That means you have to focus on your meditation, your yoga, on these exercises, because majorly diabetes comes with stress issues. Okay, so even whatever medicines you are taking, how much insulin even if you take, and still if it is not under control, so definitely you have stress issues due to which it is not getting under control. So you have to focus on those. You have to identify those issues and you have to control them also. You have to do proper exercise. You have to see which kind of diabetic you are. You are an obese diabetic or you are a lean diabetic. So if you are a lean diabetic, you have to focus more on your gymming and your bodybuilding or muscle building exercises. Whereas when you're an obese diabetic, you have to focus more on your cardio exercises. So these are the things which you need to possibly do and get your diabetes under control, as well as you can reverse it, you can stop your medications or reduce it, but all under the guidance of a medical supervision, not by your own self. And definitely with this, I would suggest that diet, exercise, mental strength, all is required for controlling your diabetes.
All right. So, all very key points over there. Mental health, physical health as well. That's all the time we have on the program. Thank you so much both for joining us. That's it on health and wellness. We'll see you again tomorrow. Bye bye.